going to talk to you today about some things that we've already covered in some detail, but hopefully from a slightly different perspective as a regulator. So I'm going to give you a bit of an overview of our concerns from a CQC perspective, what we have found in the last few years in mental health services that we've gone and visited, what those concerns and our recommendations coming out of those are, and also a bit about our work on the 5-year forward view in mental health and what we've done there. I think it's quite important to emphasise that in the work that we do across mental health policy, we try to include service users, carers, parents, representatives as much as we can. So we do that when we go into inspections, we go and speak to people. We also have service user groups that we go and speak to. So very much projects and the things that we've been doing, we've tried to get those views incorporated as much as possible. But of course, if you've got any views of your own, you're very welcome to come and speak to me afterwards. I'd be really interested to hear them. I think it's also really important to mention at this point that we're not just interested in short-term outcomes, but also long-term outcomes for people, particularly with physical health and mental health issues. So we're not just looking at the short term, but we've also thought about a long-term strategy and how we might tackle those. I think also before I start, it's probably important to bust a myth that we can tackle a lot of potentially concerns that arise due to funding and commissioning. So our scope and ability to look at those are limited, but I'm happy to go into more detail on that. So the overall picture of mental health in England, I think it's fair to say we've got 70% of trusts that are good and outstanding ratings. So that's how we're currently looking at the quality of mental health care. I think that it's fair to say that that's a reasonable picture across the country. And of those concerns, safety is the biggest one by far. So, and caring generally isn't a particular concern, but I think it's fair to say that some of these statistics can be skewed slightly because we go and look across different types of core services. So one core service that might be really inadequate might boost up the poor rating, if that makes sense. Looking at children and young people's mental health, I think looking at those stats, we're okay with them. We don't have significant concerns about them, but there's a great deal of work that we are doing on children and young people's healthcare in England. So, as I mentioned, our biggest concern is about safety. So, safe was the key question that we most often rated as requires improvement or inadequate. And as a result, it has really been central to a lot of the work that we've been doing recently. So as of May last year, 36% of NHS core services and 34% of independent core services were rated as requires improvement for safe. And further 4% of those NHS core services and 5% of the independent core services that we looked at were rated as inadequate. So what do we mean by that? Last year, some of you may have read our State of Care report, which was published around August time, and we really highlighted some of our key concerns around safety in a number of different areas. So as a result, we've pulled out some of the main themes and recommendations and had a look at how we might work with other organisations and our system partners to proactively address them. So we found a number of really specific concerns that we've tried to group into categories, but they aren't just limited to these topics. So, for example, we were looking at the poor physical environment of mental health wards and how these could be improved. One of these areas that we looked at were dormitories, and that is anywhere where there is more than one bed in a bedroom. So even a bedroom with two beds would be classed as a dormitory for our purposes. And we looked at any potential issues that might arise of service users staying in these types of environments, if that is actually an issue, and what we might do to work with our system partners to help address this and improve this. We looked at different facilities not being designed to meet the standards of today's needs and patient needs, and fixtures and fittings that might be hazards. And so we've looked at how physical environments could be improved, and as a result looked at our guidance and tools that we have on our website and updated them. We had a real look at sexual safety on mental health wards, which we've now expanded to look at potentially adult social care settings. We realised that some providers just simply aren't doing enough to protect people from sexual violence. And in looking at this, we reviewed some data over a 3-month period to try and understand the extent of this issue, what providers were doing about it, and how we could support them to improve this concern of ours. With physical restraint, we found that there was a real variation on wards, and there was a real inconsistency in the reporting and training on this, so we've looked at trying to improve that. For mental health care for people with physical health problems, this concern of ours has overlapped into a number of different projects that we've been working on, including the 5-year forward view for mental health. So there has been some duplication of our work there, but we've tried to streamline it as much as possible. We realised with locked rehab wards that there are a high number of people in these wards who are a long way from home, and we've looked at how they could be improved to better the system in that way. In high secure hospitals, we looked at nighttime confinement and the limited number of daytime activities for people, potentially due to low staffing, and also the use of long-term segregation. We looked at clinical information systems, which I know that has been talked about previously this morning, and we noted that there was a real staff frustration around clinical record systems and how they found it really difficult to get the information they needed when they needed it. So I think it's fair to say that our top priority is to improve the care of people with the most severe and enduring forms of mental illness. And when I say that, in a nutshell, I mean that we would expect to see high quality care in an appropriate setting for the service user. So we'd want to see that the environment that they are in is safe and suitable for them, that they are in a single bedroom preferably, that they have the appropriate levels of staffing and the one-to-one support that they need, treatment options accessible and open to them in the areas that they need. Secondly, I would say that we would look to support the system in reducing the number of out-of-area placements, as we've mentioned already this morning, including long-stay rehabs. And we would also look at the access to community services and making sure that people have the right access to the right services that they need, so that they can stay at home when they need to be at home as appropriate, but they can also access those services when needed in an appropriate time. So thinking about our 5-year forward view commitments, there are, I think, 50 plus recommendations that CQC are named as supporting on. And I don't intend to for a second to go into any of those in great detail, but there are 2 that we are leading on specifically in terms of key areas. And one of those is integrating the regulation of children and young people's mental health services. And the second is looking at the link between physical health care and mental health care, including things like physical health care checks. And I would say that in both of those topics, we have, if I may say so, probably gone a bit further than that and actually thought about how else we could influence the system in that way and look at improving it. So, for example, when looking at physical health care, or mental health in physical health settings, we now have had inspectors go out into physical health acute inspections and look at emergency departments, etc., and try and make sure that the staff there and the inspectors that are going out on these inspections know what to look for in those kinds of scenarios. So thinking about physical health and mental health, we have already mentioned it quite a few times today, but from a CQC perspective, we're really aware that the system does need to change in terms of how we look at people, not just as one mind and one body, but an integrated system that looks at people as a whole and treats them as a whole, instead of, I think it was Tim who said, that people look at somebody's psychiatry, potentially issues, or physical health issues separately. So one way that we've done that by looking at medicine's optimization and how people who are on certain medications might need to have those needs met or assessed on an ongoing basis. We've looked at people with learning disabilities and their specific needs and how we might support those in the system. We've really just been trying to operationalise our approach in merging the two sectors, really. And that has expanded also into primary medical services and adult social care to some extent as well. And as a result, we will now expect to see staff to be trained and competent in both mental health settings and physical health settings in each of them. Thinking about children and young people's health, and conscious of time, we have been looking at joint targeted area inspections with some of the other bodies that we work with, including Ofsted. And at the moment, we're really aware that the system is quite fragmented in terms of how children and young people access mental health. And I know that we've spoken about children and young people's mental health already quite a bit this morning. But we are looking across the system with our other bodies that we're working with in these joint targeted area inspections. So we will be working with Ofsted, and we're planning on reporting on our progress in this area in the next couple of years. We've got a number of recommendations that we've produced on a local, regional and national level, which you can see here, but I won't go into in detail due to time. And I think just to reiterate that from a CQC perspective, we're really keen to improve the system. We have certain powers and abilities to do that, but it's really important that we work together on a national, local, regional level to do that with providers, service users, our other organisations that we work with on different projects, and commissioners as well. So I don't think that it's for one organisation to take the burden of improving the system, but a joint collaborative approach to which really is needed in the long term. Thank you.